Good morning. You're welcome to my YouTube channel. Again, today, the Wellness Lab with Pressy. And so today I will talk about fibroids and pregnancy. Now, fibroids can make it very difficult for someone to get pregnant, especially when the fibroid blocks the fallopian tubes or disrupts the uterus. Now, a many percentage of women have successful pregnancies and successful deliveries even while having fibroids. On the other hand, some women might not be lucky and they might have or encounter serious complications during pregnancy and delivery. Now, about 40 to 60% of women at the age of 35 usually have or develop fibroids, and about 80% at the age of 50 have fibroids. However, it is difficult or usually difficult for doctors to predict or to tell if there is fibroid present during pregnancy. And this is because of the thickening of the uterus muscles. So that makes it difficult to determine. And also, smaller size fibroids are easy to detect or determine by ultrasound scan compared to larger ones. Now, let me go into different complications or different things that fibroid could cause during pregnancy in different trimesters. Now, during the first trimester of pregnancy, there is a usual primary problems that a pregnant woman with fibroid can encounter. And number one is bleeding and pain. Now, in a research carried out in about 4,500 women, it was recorded that 11% of women experience bleeding, while 59% experience pain and 30% experience both pain and bleeding, which shows that women with fibroids encounter these complications during pregnancy and also during the first and second trimester. Miscarriage is also likely to occur in women with fibroid. This is because the fibroid is usually located around the areas of the uterus in the uterine lining, and this is why women with fibroid are at higher risk of having a miscarriage. They are more likely to have a miscarriage. Again, women with multiple or larger size of fibroids are even more at risk of having a miscarriage. So that is one of the complications that fibroid could cause in pregnancy. And again, during the second and the third trimester of pregnancy, fibroid can also bring about serious pain, which is the most common symptom of fibroid, especially large fibroids. And this pain can cause severe cramping and discomfort in the lady or the woman experiencing a fibroids in pregnancy. Also, a situation can also occur that sometimes these fibroids they tend to outgrow the blood supply. It dies on its own in a process known as red degeneration. However, this pain can be reduced by taking pain relievers such as ibuprofen and others. So, a fibroid can also have a serious complication by bringing about placenta abruption, whereby the placenta tears away from the walls of the uterus before the baby is delivered. Now, this is a very serious complication or problem in pregnancy because the baby will not be able to get sufficient or enough oxygen, and it can even lead to excessive bleeding and shock in the mother. Also, fibroids in pregnancy can also lead to preterm delivery, that is premature delivery when the baby is being born or birthed before 37 weeks. Fibroid can also increase the chances of cesarean section as the only option for delivery. Now, this is because fibroid has the capacity to to disrupt the contraction of the uterus, and also block the birth canal, thereby reducing or the chances of labor. So see that fibroids are very they cause a lot of havocs in pregnancy. But here is the good news, and that is that fibroid or having fibroid is not a death sentence. It can be monitored, it can be managed, and interestingly, about 70% of women who had a normal live births usually have the shrinking of their fibroids after pregnancy. That is, their fibroid shrinks on their own after 3 to 6 months of giving birth in research, and this has been documented in different research. So having fibroids and you are pregnant, all you need to do is to make sure that it is being monitored. You have to constantly book for checkups with your clinician or medical doctor to examine you and know the best method to take. Again, you should do regular ultrasound scan to know the size, the location, and the number of your fibroid. So, with that information, your daughter will be able to have a good strategic plan ahead before your delivery date. So, that is very important to keep in mind, and don't forget that having fibroids is not really a big deal. You can get over it. It can shrink on its own. So you might be the lucky one who experiences that. So thank you so much for watching my video, and don't fail to follow for more wellness tip on this channel. So hit a like, subscribe, and share with someone you love. Thank you.